Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. In this next installment of the Journal Club series, I want to talk about mobile health. We can call it consumer health, digital health, or mobile health, but basically what we're referring to is a whole new generation of apps that are available on smartphones, smartwatches, or tablets such as iPads. And these applications are meant to help us track our health, and I'm sure that we all use these every day. I have an app on my iPhone that tracks how many steps I walk, and we tell our diabetes patients when they're starting to control their diet and exercise to walk at least 30 minutes 5 days a week. And so I think about that too when I go and exercise, get out there in nature and start going for walks and try to measure how much I'm doing and see if I'm improving over time. So we can do the same thing, encourage our patients to use these apps, and it's interesting how these are starting to be incorporated into our electronic health records. And I wanted to just kind of review some articles that have talked about this and get a little bit more into the detail of mobile health. So let's talk about an article that was written in 2013, a commentary actually, that talked about opportunities for pharmacists in mobile health. And a lot of the article really focuses in on using text messaging through apps and encouraging our patients to take their medications on time and to do other activities. Now, this is 2013, but this is kind of when we started having a focus on mobile health. And I will show you a little chart that was in this article. So remember, this is 8 years ago, but here are some of the names of the apps that were out there, and they're grouped into clusters. Gives you a little bit of idea of where we were when we were starting down this road. In a very recent article in the December 2020 issue of Pharmacist Letter, this really caught my eye about helping patients navigate mobile health apps. And it says here in the article that there are over 325,000 of these apps. So some of them, track your weight or your mental well-being or fitness, other things, but you can also use it to monitor physiological parameters and, as we talked before, adherence to medication therapies. Here's a very specific example. So I did go out there and I did a PubMed search on mobile health, mHealth, and tried to find articles that have been written on this topic. And it looks like there was a lot of articles being written around 2017, maybe 3-4 years ago. Not a lot of recent articles, which is kind of interesting. But this one was a specific case of where they're trying to monitor kidney transplant recipients. And they developed an app there. They encouraged patients to take their blood pressures, monitor their blood glucose levels if they were diabetic, and then record all the times that they had taken their medications. And the app actually reminded them to take their tacrolimus on time, and then take a little survey periodically to see if they were having any kind of adverse reactions to their medications. And so I thought this was really good. They were gathering this information. The patient was putting it into their smartphone and then uploading it into the portal so that the pharmacist could have a dashboard view of what was going on with the patient. The other thing that they were doing was from the hospital EHR, or the health system EHR, they were actually downloading data every night into the portal also, and then merging it with the patient data. And so from the hospital system, they were getting tacrolimus level variability and finding out if the patient was adhering to their appointments, coming in on time to do their appointments, and also if they were refilling their medications on time too. So they felt that these were very reliable measures, And if they were faltering in any of these areas, then they could be considered high-risk transplant recipients. So think about it. If we have all this information that the patient is gathering, and then we also have our electronic health records, and we can merge those, let's say, not necessarily in a hospital, maybe an ambulatory care clinic where you're seeing diabetic patients. Right now they have to bring in their glucometer, and you have to look at the data and their sugars and try to decide what's been going on with their glucose levels after their night dose and then meal doses, and try to adjust those. And if all that information was actually being collected on the glucometer and then automatically transferred to the portal for your ambulatory care clinic, you could pretty much real-time monitor your patients and see how they were doing on their therapies, if they were having any incidents of hypoglycemia or other problems with their therapies. And you can see how this would be very useful. So mobile health is great for the patient themselves to monitor their physiological parameters, to monitor their exercise, even diet. There are a lot of apps that help you to track what you're eating, what you're doing every day, and trying to stay healthy. And then if we can pull this information in and merge it with other data that we have on the patient from our electronic health records, that really helps us to be more effective as pharmacists in improving the therapy of our patients and monitoring our patients and making sure that they have the best outcomes possible. I hope this little adventure into mobile health was interesting for you. If so, please like this video, and I'll thank you for that, and subscribe to my channel. And in the meantime, stay safe, stay healthy, look after the health of others. I'll continue to work on more Journal Club and other episodes, and I hope to see you next time. Take care.